at uiradionetwork.org. Catch us on Facebook and Instagram at United Intentions and Twitter at Higher Intention. Look for us on 99.1 FM, iTunes, iHeartRadio, Spreaker, Stitcher, Blog Talk Radio, and many more. Over the next hour, we'll introduce you to some fascinating people and engaging discussions that may provide you with answers to assist in revolutionizing your own personal health. And now, here's Dr. Nelson.
Hello, I'm Dr. Nelson Bulmash. You're listening to Health Matters on the United Intentions Radio Network. If you're catching the show here in Atlanta on WDJY FM 99.1, in Florida on WWNN 93.5, and now in Kentucky on WMTA 107.3. Hello, thank you, and welcome. It's great to have you listening. And for all those of you who are listening on all the major social media platforms like Facebook Live, it's a pleasure to have you here. Remember, folks, Health Matters is a talk show where we discuss all things under the umbrellas of health, inspiration, and spirituality. I have another amazing guest today. You're going to learn lots about how to prevent from having a heart attack. Hang on, I've got a few announcements before we get started. Number one, I spoke last show 2 weeks ago about you having the opportunity to get this collection of DVDs. It's called Get Your Life Back Now. And if you don't have a copy, simply go to www.getyourlifebacknow.live. This is an amazing compilation. You have legends like Dr. William Lee Cowden, who has been around for a long, long time and is one of the leading authorities in the world, as I understand it, on heart disease and taking a functional approach to helping alleviate problems with heart disease. So do so at the end of the show. Don't miss the show. Wait till you're done and then order your copy of How to Get Your Life Back Now live. Now, a couple other announcements. We are beneficiaries for the City Gala this year, and for the first time, the flagship event will be in New York City, September 22nd, and it is action-packed. You'll have the chance to bid to meet Leonardo DiCaprio, Justin Timberlake, and Conor McGregor. To learn more, please visit www.classicny.org. By the way, we will have the next event right here in Atlanta on October 13th. Don't miss it. This event is big. We were one of, gentlemen, am I correct to say one of 10 businesses that were selected out of hundreds who made a bid for this? That's right. It's all about building your life and your business from a conscious perspective and doing so while networking and integrating people of like mind to do so. It'll be amazing. If you're able to go to New York City, September 22nd, join us for that event. If you're able to do it here in Atlanta on October 13th, we'll look forward to seeing you there. I will be there for one. And you'll have the opportunity to meet me and many other like-minded people. Now, a couple other things, and then we'll jump right into this exciting interview today. Tomorrow at 4 p.m. Eastern Standard Time, we have Maria Sullivan, who will be interviewing Dr. Stan Beecham for her new show, Best Self, Better World, on WGJY FM 99.1. She'll be talking to Dr. Stan about how to become the best version of yourself and retain your brain to think like a winner. And I want to throw in one more last announcement before we get started. My friend and colleague, Dr. Amy Daries, will be on at 6 p.m. Eastern Standard Time, and she'll be doing her show, Whole Health. I'm not sure who her guest is. Whole Healing, excuse me.
Ryan Wexler.
What? Dr. Ryan Wexler will be her guest. She'll be interviewing him once again. It'll be this Thursday on all the same bat times, bat channels as today, but her show will get started at 6 p.m. Eastern Standard Time. All right. I want to jump in. I'm so excited about my guest. She's an amazing person and colleague, and she has some really great information. Remember, we're going to be talking about all things functional in nature so that you can take the legacy of your life into your own hands, and you can prevent at least having an early onset heart attack that might debilitate you or take your life. She graduated from, I'm laughing because we're from the Big Ten, both of us. I went to Michigan and she went to the University of Illinois, an outstanding school, but there's a nice rivalry there. We both graduated in biology. She got a bachelor's and a master's from the University of Illinois in biology. Tell us about your professional career, Dr. Ellie Campbell.
Oh, Nelson, it's so nice to be here. Thank you so much for having me.
You're welcome.
I'm excited to share information with your listeners, but they might want to know a little bit about me. So I grew up in suburban Chicago, went to Illinois. Then I did medical school at the Osteopathic Medical School in Kirksville, Missouri.
Right.
Went to my rotating osteopathic internship in Tucker, Georgia at Doctors Hospital. One winter here, I decided I wasn't heading back to the Midwest.
Get that.
Finished my residency training at the Medical College of Georgia in the Department of Family Medicine. Absolutely love those people. And they trained me in a very allopathic manner. My osteopathic medical school was body, mind, and spirit.
Right.
Allopathic medical school teaches you a much more didactic way of thinking. And frankly, after 13 years practicing it, it started to fail me. My patients weren't getting better. In fact, all I was doing was writing more prescriptions. So I took a path to integrative medicine, became board certified in integrative medicine. I practice functional medicine because getting to the root cause of what it is that makes people sick is life-changing.
Yeah.
And the practitioners, Brad Bale and Amy Deneen, wrote a book called Beat the Heart Attack Gene because they too can get to the root cause of what it is that causes heart attacks, and we can prevent them. So that's what we want to spend the next little while talking about, is how to help people never have a heart attack.
And this is important because, as we both know and many others do, it's the number one killer in this country.
Absolutely. And 50% of people who have a heart attack have normal cholesterol. So that's so hard to believe that we go to the doctor and we check our cholesterol. They say it's normal. We think we're fine, and we go on to have a heart attack.
Yeah. Well, I'm so happy you brought that up, because my first question to you is, Ellie, what is the relationship between cholesterol and heart disease?
Yeah, it's not what people think. And it's probably one of the first of 7 deadly myths that we're going to talk about today, which is that cholesterol causes heart attacks.
Right.
It's a myth. Cholesterol does not cause heart attacks. Heart attacks are caused by blood clots, not by heart attacks. I'm sorry, not by cholesterol.
That's okay.
And so the way that it works is that cholesterol is a lot like teenagers. I got to
hear this.
I have 3 daughters. They're 19, 21, and 23. So we had 3 teenage daughters in our house all at one time.
Wow.
Well-behaved teenagers were welcome at our home, but corrupted teenagers got no business near my girls.
I got it.
Cholesterol is the same way. Well-behaved cholesterol is a great molecule. We need it. It's bodybuilding. We use it to make hormones. We use it to make vitamin D. We use it to make cortisol. But corrupted cholesterol is a whole different story, and corrupted cholesterol causes trouble and starts the atherosclerotic buildup.
Very, very good. Thank you for clarifying that. And folks, we have a lot of other great information. You want to pay attention. Don't you run away from your computer screen or turn off that radio dial, because this is going to be, you're going to have some really, really wonderful information that can change your life. No kidding. So pay attention. By the way, we're going to be taking your calls. I didn't mention this, but I want to be sure I do. If you're listening to us on Facebook Live, you'll see the call-in number scrolling at the bottom. It's 678-495-4345. I'll slow down. That's my northern influence here. Once again, that's 678-495-4345. Don't worry if you're driving. You can pull over in a little bit. I will give you that number again. Folks, by the way, if you're on Facebook Live, you're welcome to ask us questions at any time. I would prefer, if you're going to call in, that you wait till at least 5:20 so we can get into the meat of the matter, so to speak. Okay? All right, Ellie, let's go in, and I want to look at measurements here. We talk a lot about testing and so forth. So let's look at low-risk measurement. Does that mean low risk of disease?
Right, that doesn't, and that's another myth. Low-risk measurement does not mean low-risk disease. When you go to your doctor for a physical, they're probably going to collect some numbers. And so they're probably going to collect your blood pressure, maybe your blood sugar, probably your LDL and HDL triglyceride numbers.
Right.
And then they might even, if they're really good, calculate your body mass index, a mathematical calculation based on your height and your weight. And they'll determine if you're overweight or obese, and they'll give you a risk that they'll assess you for. They'll say, are you low, medium, or high risk for heart disease? They might even do some numbers called the Framingham Risk Score. You can go online and Google it and calculate your own Framingham Risk Score. The problem is that these are antiquated numbers. They're based on old data, and if your number is high risk, it's meaningful. Absolutely. If you come up with a high risk number, you're in trouble.
You're in trouble.
And you need to be in the trenches with your doctor, changing your risk factors. But even if you have low risk numbers, you can still have a heart attack because they're not looking at the root causes in the proper way.
I'd like to explore that a little bit, Ellie, if you would. What exactly does that mean? Let's say, so you and I both know that about 50% of the people who have heart attacks don't have elevated cholesterol.
Exactly right.
Yeah, thank you. So let's put it together. When we're looking at lab values, we know that they influence our thinking about what an individual's risks are. And we know, you had a really good point. If they're high, you're in trouble. What are some of the markers that we do need to pay attention to? And I know, folks, we're going to get a little technical here. Don't worry, you can rewind the video. And if you're listening on the radio, we have hard copies of this so you can look at it and listen to it again. Let's go into some of the numbers that are really important for us, because I agree with you. Cholesterol in and of itself is antiquated. It's an agent, it's a component. What are some of the newer perspectives on functional measurements that we really, Ellie, need to pay attention to?
Yeah. So we talked about how cholesterol is only a problem when it gets corrupted.
Right.
How do you know if it's corrupted? So there's some blood tests that we can do to tell us that, because cholesterol gets corrupted 3 primary ways. It gets corrupted if it's sugar-coated.
Right.
It's sticky. It gets corrupted if it's oxidized or rusted.
Okay.
And it gets corrupted if it's the wrong shape or size. So we have markers that can measure those things. So we can check to see if it's sugar-coated by looking at your blood test called hemoglobin A1C.
Okay.
This is a blood test many doctors will do on their diabetics, but they don't think about measuring it in a patient who doesn't have diabetes.
Right.
And you should ask for it, even if you're not a diabetic. Another marker that they should look at is called oxidized LDL. We're kind of familiar with the LDL molecule. People call that the lethal cholesterol or the lousy cholesterol, the bad cholesterol. But even that, there's very little data that it's a problem unless it's corrupted. And if it's oxidized, there's a blood test for that called oxidized LDL.
LDL. Okay.
So you should ask for that marker too. And then the third way is the cholesterol has become the wrong shape or the wrong size. When you have a strong and healthy liver, your liver should be puffing up your cholesterol before it dumps it out into the bloodstream. Most people don't know that your liver can make 10 times more cholesterol than you could ever eat in a day.
Right.
Your liver makes cholesterol. And if it's doing it in a healthy way, the cholesterol will be big and puffy. I call them jet puff marshmallows. They tumble through the arteries and they don't stick. But if your liver is sick, or you are eating the wrong kinds of food, or you're very inflamed and rusted on the inside, the marshmallows will be tiny. And so they're mini marshmallows, and mini marshmallows are sticky, and they get caught in the nooks and the crannies of the arteries, and they start to build up plaque. So you don't want tiny marshmallows. So you ask your doctor to measure your LDL particle size. And you want to have large particles. On some tests, they're called size A versus B, which are the bad ones.
Right.
On some, they actually give you a number, and you want that number to be more than 1,000. You want more than 1,000 marshmallows in every serving of your blood.
Sorry, what a fabulous visual to understand this concept. Thank you, Ellie.
So those are 3 important markers. You want hemoglobin A1C to look at your blood sugar. You want oxidized LDL to see if it's rusted. And you want marshmallow size, LDL particle numbers or particle size.
I'm going to take a little bit of a risk here, Ellie. I know that many people are actually starting to come in and talk to me about the functional marker known as hemoglobin A1C. Would you mind going through the numbers and letting people know?
Sure.
For example, I had a woman come in who wanted to be a pilot, and her hemoglobin A1C, better hold on to your chair, was between 13 and 14.
Oh, my goodness.
Yeah.
That woman had diabetes and didn't know it.
Yes. Now, interestingly, I put her on a protocol, and within 6 months, her third test was 5.6.
Awesome.
Yeah. So let's talk numbers. So people have something, so when they see their blood work, they have some understanding about what these numbers mean.
So if you go to the African plains and you find hunters and gatherers who have to forage for everything that they eat or hunt it and take it down and physically butcher it in order to eat it, their hemoglobin A1C will probably be around 3.5 or 4. So that's the lowest that you're ever going to see, is around a 4.
Okay. Thank you for elucidating that. That's interesting. I had no idea it could even go that low.
Any number above 6.5 is diabetes.
Right. Okay.
So when a diabetic is being treated, any number above 8 requires that they change therapy. They need to be working with their doctor to be more aggressive to get it down. Because the higher the hemoglobin A1C, the more sticky your blood becomes and the more risk you are for complications, including heart attack, stroke, kidney failure, and erectile dysfunction. So we don't want...
Hear that, men out there?
We don't want high sugar. You don't want to get the sugar noodle.
Yeah. Yes. No. Oh, goodness. Yes. I got it.
Right.
All right. Here's another myth that I want to bust open, Ellie. Let's talk about the myth of a mild disease. I have mild diabetes. I have mild heart problems. I have mild kidney disease.
Right. I'm mildly pregnant. Right. So it's the same. You can't just be a little bit pregnant. You have to be, it's an all or none condition.
Got it. Ellie, we're going to take a break here, and then we'll be right back. Folks, my guest is Dr. Ellie Campbell. She's an integrative medical doctor. We're talking about the 7 deadly myths of managing heart disease. I'm Dr. Nelson Bulmash, and you're listening to Health Matters. We'll be right back.
My name is Tim Ray, the founder of the United Intentions Foundation and the UI Media Network. We have an exciting event coming to Atlanta on October 13th. United Intentions and City Gala are hosting an Atlanta Mastermind.
You're not going to want.
All right, Dr. Nelson Bulmash here. I have my wonderful guest, Dr. Ellie Campbell. She practices family medicine. She's an integrative medical specialist, and we're talking right now about the 7 deadly myths of managing heart disease. And the specific topic we were talking about before we took a break was we were talking about hemoglobin A1C, because we want to watch to make sure that sugar doesn't bind excessively to cholesterol. In doing so, it creates an increased risk of heart attack. Ellie, let's jump back in real quickly and go through the numbers of hemoglobin A1C, so anybody with their sitting there in front of their computer screen and listening and watching who might be digging out. I'm sure there's somebody there digging out their blood results and looking at their A1C numbers. Let's talk
and they're
about
going to be
numbers.
surprised because the evidence tells us that any number above 6.5 is diabetes. But Dr. One of the experts in the world of Alzheimer's disease, David Perlmutter, tells us that any number above 5.2 increases your risk of Alzheimer's disease. So we want everybody to be below 5.2 because your brain is just as important as your heart. So in my office, that's our target. We want your fasting blood sugar to be between 70 and 80.
Right.
And your hemoglobin A1C never above 5.2. Now, even that being said, if your number is above 5.7, you're pre-diabetic. If your number is above 6.5, you're actually diabetic.
Wow. So my friend and patient with I can't remember, it was between 13 and 14 for her numerical value with her A1C was in really, really, and I knew she was, of course, but.
She was in extreme danger.
In danger.
Yeah, absolutely.
Wow.
And there's another point about blood sugar that I want to make, and that is that for many people, they manage their blood sugar in the fasting state pretty well. But if we challenge them with the carbohydrates, even eating a piece of fruit, their blood sugar will spike. And spikes of blood sugar are equally damaging to the brain and the heart.
Right.
And so we'll miss that in standard blood testing. So another test that you want your patients to ask for is something called a 2-hour glucose tolerance test, or a 2-hour postprandial blood sugar. That means you're going to go to the office fasting, have a blood test, drink a sugar drink that has a very specific number of grams of carbohydrate, 75 grams. And then you're going to sit in the office and read a magazine for 2 hours, and then they're going to come check your blood again at the 2-hour mark. And they're going to check and see, comparing your fasting to your 2-hour blood sugar reading. And very often you'll identify people who have impaired glucose tolerance that didn't have trouble in the fasting state. And this is especially true for women.
Interesting.
Women will manifest impaired fasting glucose about 5 to 7 years before they get high blood sugars fasting. So we have about a 5 to 7 year window to identify and get them off the path that they're heading straight towards diabetes. If they know about it, they can change it.
Fantastic. Because what so many people don't seem to get, Ellie, I mean, I know you and I are doctors, but I meet so many people who are so nonchalant about having diabetes, and they don't understand that it increases pretty much every form of death imaginable. Cancer.
Shortens your life.
Yeah, it shortens your life, absolutely.
And makes you miserable along the way.
You got it. Yeah. I mean, everything from increased risk of cancer, heart attack, strokes, renal disease, degenerative chronic diseases like autoimmunity and so forth. So,
Absolutely.
Yeah, this is nothing to play around with, in other words.
Absolutely not.
Yeah, thank you. So let's talk about the standards of care. Do they actually equate to optimal care?
Yeah, so my friend Tom Blue gave us this great quote. He said, "The standard of care is the lowest common denominator by which doctors are expected to practice, below which they are criminals."
I love that.
So what that means is that if you're practicing standard of care, you're doing the same as everybody else.
Yeah.
And what we really want is a physician who's going to treat you like an individual, who's going to take care of you in a precise way, unique to your genes, your history, your exam,
right,
and their clinical experience, and do the best that they can for you. So you want optimal precision care. You don't want standard of care.
So we're looking for unique care here.
Absolutely.
Is the bottom line. We're not interested in every patient gets this battery of tests. We want somebody who can look at your genetics, who can look at your history and say, this is your unique presentation. Now let's go from here.
Exactly. Because while genetics are only about 20% of the equation, that's one of the reasons why the book is entitled Beat the Heart Attack Gene, because 80% of your risk is your lifestyle.
Got it. That's incredible. Did you hear that, folks? 80%.
It's
Ellie?
in your hands. You have the capacity to change your future.
Let's see if we can say that at least 3 more times during the show, Ellie. Ellie, listen, we've got a radio. We've got somebody calling in for a radio show here online, right? Yes, not on Facebook, but online here. Okay, hello. This is Dr. Nelson Bulmesh. Who am I speaking with?
Yes, hello, Dr. Nelson. This is Jesse. I'm an avid fan of your show, and I'm really happy I was able to get through the line.
Great. You're very, very welcome, Jesse. Thank you so much. What's your question for Dr. Campbell?
So I have a question, yes, for maybe for the both of you as well. I remember that knowing that my family has a history of high blood pressure and diabetes. And what I'd like to know, or I'd like to talk to Dr. Ellie about, is if you're saying that the majority of this can be prevented, how is it that it becomes genetic, meaning it's in my family? How do I avoid that, or how do I become to the point where that's not a factor in my life anymore? And how do I avoid that pre-diabetic diagnosis that so many of my family members have received in the past years?
That's a really, really great question, Jesse. Ellie, go to town.
Yeah, so when we talk about lifestyle and genetics, we often say that genetics loads the gun, but it's lifestyle that pulls the trigger. And so just because they have the genes doesn't mean that the gun is going to go off. Just because you have the genes doesn't mean that you're going to be able to manifest that condition. So you have the power in your lifestyle 80% of the time to not make that gene manifest. And it doesn't take very long. There was a study out in California of men who had prostate cancer, and they put them on a low-fat vegan diet for 90 days and then rechecked their bloodstream. And in 90 days, they changed over 600 genes related to cancer.
Wow.
So it's really just a matter of identifying for you what the perfect diet, exercise routine is, and to include other lifestyle measures where you eat clean food, drink clean water, exercise most days of the week, get adequate sleep, pray and meditate, and most importantly are part of a community, because being a part of a community with purpose is one of the most important longevity measures that we have ever been able to calculate. So keep moving. Don't sit around with the remote control in your hand, and that's one of the best strategies to not end up becoming diabetic, even if you have the gene.
I see. So you're telling me if I can change my lifestyle and change my diet in maybe not 90 days, but it's in some period of time, I'm able to reverse my pre-diabetes or my diabetes.
Yes, absolutely. I had a patient that I saw not long ago who came to see me. His hemoglobin A1C was well over 11. He was on insulin and on metformin. We changed his diet, and put him on some supplements, and he started walking 2 miles every day. He had never done any exercise since high school, and walking 2 miles a day and taking his supplements, he came off of his insulin, he came off of his metformin, and his hemoglobin A1C has never been above 5.5 since we started taking care of him. So he totally reversed his diabetes with lifestyle and exercise.
Wow. That's really good. That's really good to hear from my family. I hope my family had heard that.
Well, the neat thing is we're recording the event, Jesse, so you're welcome to let them all sit around the table, so to speak, and watch it later.
Sounds good to me.
Thank you for your question, Jesse.
Absolutely.
Have a great night. So this is interesting that he brought up his family, because everybody has genetic tendencies, but I love what you said. So in other words, because you have those tendencies doesn't mean you're going to manifest those tendencies. So what we know, Ellie, is that if you eat a particular way, you can either activate the gene expression or you can inhibit the expression of those genes.
Right.
So folks, you heard her, 80% of what's expressed is related to what you do to your body, how you take care of it with regard to what you drink, what you eat, your ability to connect with source through meditation, through prayer, exercise, and so forth. So one of the things Dr. Ellie and I really want you to understand is that this is in your hands. You're not a victim of circumstances. So take control, pay attention, and do the things that will help you trend to a more healthy, satisfying life. Ellie, I want to hit, I'm sorry.
I was going to say knowledge is power.
Yes.
So when you go to your physician and you get these data markers, now this empowers you with information. Another test that I like to recommend is one called lipoprotein A, and it's lipoprotein with a lowercase a in parentheses.
Right.
Lipoprotein little a is mostly genetically determined. It's very difficult to turn that gene off. But if you have lipoprotein A, it's not tested for by most doctors. So they will look at your regular cholesterol numbers and your blood pressure and your blood sugar and think you're in good shape, when in reality, you're progressing to cardiovascular disease. And when we talk about testing methods, we can talk about how you might find out if you have hardening of the arteries because you have lipoprotein A as a hidden risk factor that's genetically determined. But then you can double down on your efforts to exercise, sleep, pray, meditate, et cetera, et cetera.
Fantastic. Question that comes to mind, and I'm getting more and more of this, Ellie. A lot of my friends are saying, should I become a vegan? Do you think it's a requirement to become a vegan?
It is not a requirement to become a vegan, although there's lots of evidence that it is heart healthy to be a vegan.
Okay.
It's equally heart healthy to eat a Mediterranean diet, which is only has red meat about once a month, but fish almost every day.
Okay.
So you don't have to be vegan and you can still have a healthy heart.
Good. Excellent. 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 All right. I want to explore a topic here that not many people talk about. I'm familiar with it because I have a very good friend, Dr. Thomas Bach, who's a maxillofacial surgeon. You and I spoke about this earlier, who's very big on looking at oral issues and their contribution to heart issues. Let's talk about that.
I'm so glad you asked.
Yeah, well, it's an area I'm very familiar with, so let's talk about it.
We call this the oral systemic connection.
Okay.
And there's 3 ways that are underappreciated as contributors to cardiovascular disease that start in your mouth.
Right.
The first is breathing. Sleep apnea is often undiagnosed, and it's a continuum. You can have a restricted oral airway that's not quite sleep apnea, and maybe need to wear a little oral appliance to keep your tongue out of the back of your throat so that while you're sleeping, you get better oxygen.
Right.
If you lose oxygen while you sleep, you will accelerate your rusting on the inside and drive your cardiovascular markers.
Okay, so you get increased oxygenation from low oxygen delivery.
Exactly right. And your cells, your mitochondria become sluggish, so you don't burn calories very efficiently. So if you have sleep apnea, you tend to be overweight. Some people who get their sleep apnea treated will lose 5, 10, 20 pounds without changing how they eat at all, just because their metabolism got sped up. So if you want to lose weight, be tested for sleep apnea.
Excellent, excellent.
Another thing that the oral systemic connection is related to what we call endodontal disease. This is bacteria that live at the base of the tooth root, especially in root canal teeth. So where you've had a root canal in the past, bacteria live. And bacteria are our friends. We have to have bacteria.
Right.
But some of these bacteria become our enemies. And some of these bacteria are, especially the type called gram-negative, they create a protein or a sugar called lipopolysaccharide, and it floats in your bloodstream and acts like little needles to poke your arteries and cause holes for the cholesterol to build in.
Interesting relationship.
Yeah, so these mouth bacteria get in your bloodstream. In some studies, up to 100% of plaque in people's necks that cause strokes has mouth bacteria living in it.
Wow. Ellie, we're going to have to take a break.
Oh.
This is so, I know, it's so hard. I love talking about this. I wish we could do a 4-hour show. Folks, Dr. Nelson Bulmash here. You're listening to Health Matters. My guest is Dr. Ellie Campbell. We're talking about 7 deadly myths of managing heart disease. We'll be right back.
Somebody set Sophia free before she burns a hole right through me. Somebody let Sophia fly from a hidden place locked deep inside.
Imagine a world where there's always a helping hand, a world that leads with good intentions to create a positive environment to live in. Well, look no further, because it all starts from within. I'm Maria Walden Sullivan, and this is Best Self, Better World, a radio show on self-improvement, self-discovery, and giving back to make the world a better place. You know what they say, you can't help others if you don't help yourself. That's why I bring in people and nonprofit organizations that help us become better people so we can create a better world. Catch us on Facebook Live at United Intentions and on Spreaker as United Intentions as well. We're also on iTunes, Stitcher, SoundCloud, and many more. You can also call in at 678-495-4345 and ask me or any of my guests questions you'd like to know that can help you on your journey to self-improvement. This is your power hour to become who you've always wanted to be and give the world a little piece of you. So sit tight, grab a pen and paper, and get ready to become your best self for a better world.
All right. Dr. Nelson Bulmash here. Folks, you're listening to Health Matters, and my guest is Dr. Ellie Campbell. Let's get back to it. Okay, Ellie, we were talking about oral health. We spoke about the importance of sleep apnea and how important it is to oxygenate the cells so we produce more energy, we increase our metabolic rate. And we spoke about endodontal problems. So we have bacteria at the roots that contribute to increased risk of heart attacks and strokes and so forth. Let's talk about the periodontal contribution.
Yeah, so many people have gum disease, also called periodontal disease. And people will know this if they have it at home. They don't have to go to the dentist to be checked. If there's any blood in the sink when you brush or floss your teeth, you have periodontal disease.
Okay.
Blood is never, ever normal in oral care. So if you are brushing or flossing and there's blood, you're in trouble. Periodontal disease causes tooth loss. That's why it's dangerous. But it turns out that 5 bacteria that also cause wiggly teeth, gums receding, and tooth loss, 5 of those bacteria also cause atherosclerosis.
Oh, interesting.
They cause hardening of the arteries by 3 different distinct mechanisms. So it's pretty technical, but Brad, Bale, and Amy Doneen wrote an article published in Postgraduate Medicine that describes this in great scientific detail. But what your listeners need to know is those bacteria that live in your mouth will cause hardening of the arteries if you don't chase them away.
Wow. Ellie, one of the things that Dr. Bach and I talked about when we teach our patients, and I'm going to ask you if you do, is we irrigate the gum line.
Yes.
So we get in, whether it would be with salt water or specific oral solutions to constantly clean out and reduce the depth of these pockets. Yeah.
Because those pockets, the deeper the pockets are, the more dangerous they are.
Sure.
For tooth loss as well as for periodontal bacteria that can cause heart disease. I totally agree with the idea of using a water pick or a
water irrigation
device of some kind
Yeah.
to get those bacteria out. Flossing also helps break up the biofilm because teeth bacteria are really smart and they don't want to be killed by the food that you're putting past them or by chewing mechanisms. So they create a layer of slime and they wrap themselves in the slime. You call it plaque. But isn't it interesting that dental plaque and coronary plaque are probably the same thing?
Yes.
Which are bacteria wrapped in slime.
Yeah. So, any insight on how to break that slime barrier so we can kill the organisms that contribute to heart problems?
Absolutely. So, like you talked about, using a water pick is a good idea.
Right.
I don't like to think of a toothbrush as a device that should brush your teeth. Actually, a toothbrush is a device that should massage your gums. And so, if you think about that, and after every meal, you're doing something to clean your teeth, there's a sugar alcohol molecule called xylitol. Xylitol is often used as an artificial sweetener, but it turns out it's also a mild antibiotic and a mild prebiotic. So the healthy normal flora that live in your bacteria in your mouth that are supposed to protect you from the bad bacteria, they love xylitol. And so they grow in greater numbers when xylitol's around.
Interesting. Very, very interesting.
So it's a good idea to have if you're going to have to chew gum, make sure it's a xylitol gum.
Got it. Thank you for that. What a pearl, Ellie. Ellie, apparently we have another question. Is it a call in or from Facebook? Facebook. Okay, what's the question?
Okay, so this is a Facebook question from Mr. Charles. He asked, what medical intervention do you recommend for the patient over, I believe it says 8.0?
Okay.
Does that make sense to you?
Yes. So the question is going back to the idea of hemoglobin A1C.
Mm-hmm.
So he's asking what medical intervention is necessary whenever a patient has an A1C above 8, because that's the guideline from the American Diabetes Association that your diabetes is out of control. So there's many interventions. It depends on the patient. Sometimes I will put a patient on insulin, metformin, or pioglitazone in order to, those are prescription drugs, to get the patient's diabetes under control.
Right.
Working with a health coach is a really fabulous way to take a deep dive into your blood sugar and to see if you're eating something that's not that is contributing to your blood sugar. People don't appreciate often how many carbohydrates they're eating at any given meal.
Sure.
Because fruit is a carbohydrate, milk is a carbohydrate, vegetables, some of them are very high in carbohydrate with a high glycemic index, and they'll spike your sugar.
Right.
So you might eat a piece of white bread and get a certain blood sugar spike, but then eat a piece of wheat bread and get a higher sugar spike. So many people have no idea. They thought they were eating wheat bread and getting an advantage, but in their bodies it's not, and it makes their sugar spike. So checking sugar regularly and changing your diet is an important way to get that A1C down below 8.
So I'm guessing one of the things that people out there who are listening to us could do is, there are a lot of books out there right now, Ellie, on how to eat in a way that you don't elevate your insulin and how you can control your insulin better. Do you happen to know any off the top of your head that you recommend?
Dr. Perlmutter's book, Brain Maker, is about preventing diabetes, and he's got a lot in there. Sugar Busters is a pretty good book. And there's others I can't think of.
That's okay. Those are certainly two really good books. But know this: there is a wide assortment of books now at Barnes and Noble, Amazon, that deal with this very subject about eating in a way that you do not cause spikes in your blood sugar level. This is very, very dangerous. You know, we were talking about that earlier in the interview. You want to keep the regulation of your blood sugar very effectively managed, and you want to keep it low. Dramatic spikes cause big problems with your organs and your physiology.
And fiber is your friend, because the higher the fiber content, generally speaking, the lower the sugar spikes will be.
Excellent point. And speaking of that, eating good fats, another way to do it.
Yeah, good fats help modulate too. So
and protein, sure.
Having that balanced diet, and the right diet for you isn't necessarily the right diet for me.
Yeah, let's talk about that. That really, and Charles, hopefully that answers your question. And thank you very much. And you stole my next question, Charles. That's okay. You're part of the show. Thank you. I was going to ask that as my next question, not the specific number, but dealing with that very topic. Ellie, if I may, I'd like to jump into this book. You're a real strong advocate. You know these folks. You say they're very, very sharp. Do you mind talking about this for a minute?
Beat the Heart Attack Gene, Brad Bale and Amy Deneen. If anybody is in your audience who is a practitioner, they offer a continuing medical education course to learn their method. With their method, they guarantee that a patient will not have a stroke or heart attack.
Wow.
Right.
Ever?
Ever. Even if they've already had one.
That's
ever.
incredible. I will be one of the people purchasing this book when we're done.
Right. So it's basically a root cause resolution strategy. We get to the root cause of what are all of your risk factors that are leading to your development of atherosclerosis. If you don't have atherosclerosis, we have one path for you. If you do have atherosclerosis, we're much more aggressive about digging deeper and deeper and deeper. Do you have gut dysbiosis? Do you have blood sugar abnormality? Do you have the wrong types of cholesterol? Do you have family history, genetics? Do you have sleep apnea that's not treated? And we go, there's
fantastic
lots of ways, and they're all outlined in this book in a case study kind of a way. It makes it really easy to read.
Ellie, I want to look at this. So one of the things you said is if you have atherosclerosis. So let's talk about that for a moment, because how might somebody know if they actually have atherosclerosis? What are some ways that we can determine whether or not this is a problem that we uniquely have?
Well, the standard of care way, which as we've determined is not the best way always, is to do a stress test.
Okay.
And if you flunk your stress test, you probably have atherosclerosis. And that's bad.
Okay.
And that needs to be treated aggressively. But just because you have a normal stress test doesn't mean that you're free and clear. So there's two tests that we generally recommend. First is an ultrasound test called a carotid ultrasound. The carotid artery is that artery in your neck, the one the vampire goes for. And,
right.
And when we do an ultrasound of your carotid artery, we specifically request a test that's not done by most of your health screenings that are done at churches and Lions clubs and that kind of testing. It's called a CIMT, and that stands for carotid intima media thickness. So we're actually going to use the computer to measure the thickness of your artery behind the drywall, because that's where the plaque forms. 99% of the plaque forms behind the drywall before it ever ruptures and causes a blood clot that causes that sudden event. So we can not only measure it and see if you have atherosclerosis, but then track and monitor it over time to see if it's shrinking, because we can make it shrink.
Yes, I've done that myself.
Yeah.
Yeah.
So CIMT carotid ultrasound is one test, and the other is called a coronary artery calcium score. This is a CAT scan of your heart. It's done at the hospital with a CAT scan machine. But the good news is that the good and the bad news, it's not covered by insurance. So they have to have a cash price for it. Most facilities throughout the United States, the cost for this test is between $100 and $200.
That's pretty reasonable.
For a CAT scan.
For a CAT scan?
So they're going to look at your arteries. And if you have any calcium, you have atherosclerosis.
Wow. Okay. Very, very interesting. Ellie, I want to look at, you have a really amazing reputation here. No, it's true. I mean, one of the things that anybody who knows me well will say is he says what's so. So you have one of the reasons I have you on my show is you have a really stellar reputation. Share with us some of the cases. Share some of these amazing cases. For example, I was sharing with you earlier that I had this friend of mine who's now down to 5.6. Her original hemoglobin A1C was in excess of 13. I know you've got lots of great studies, cases, and so forth.
I want to talk about one patient who was really fascinating to me because nobody would have thought she was at risk for cardiovascular disease at all. And I did this deep dive. Her lipoprotein little a was normal. Her cholesterol numbers were normal. Her blood pressure was normal. She had a normal body mass index. She was close to underweight, if not, certainly not overweight.
Right.
She had normal hemoglobin A1C in like around 5.2. Everything was great, except there's a test I didn't talk about called myeloperoxidase and LP-PLA2.
I understand why you took a moment to think about that.
Yes. These are markers. They're made by white blood cells in the plaque. If the plaque is rumbling like a volcano, LP-PLA2 will be elevated. If it's actually ruptured into the blood vessel wall, myeloperoxidase will be elevated. Her LP-PLA2 is elevated. I had no explanation for this. Why would this woman with no cardiovascular risk have smoldering, rumbling artery disease? Couldn't figure it out.
Just out of curiosity, Ellie, did she have any family members?
She did not have a family history of heart disease.
Okay.
And I said, okay, I know about endodontal disease. I'm going to ask you about your teeth. She says, well, I have 5 root canals. And I said, well, let's go get your teeth checked. Now, interestingly, in traditional Chinese medicine, the wisdom teeth are connected to the heart energetically.
Yes.
So I said, let me ask you to have your dentist check your wisdom teeth. She goes, why would he do that? They were pulled 30 years ago. I said, well, just humor me and have your dentist take an x-ray of your wisdom teeth socket. She had an abscess in her wisdom tooth socket 30 years after her wisdom teeth were pulled.
Wow.
She had no symptoms. The dentist took her to the operatory, cut through perfectly healthy gum tissue. She had no symptoms of this disease, but when he pulled her gums apart, down in the bottom was rotten, infected bone. He had to do a surgery and remove all that infection. And then her LPPLA2 came right back to normal.
Fantastic. Ellie, what a great case study. Thank you. We're going to take a break real quickly, commercial break. Folks, Dr. Nelson Bulmash here. I'm with my guest, Dr. Ellie Campbell. We're talking about helping to lessen your risk of heart disease. We'll be right back.
Are you ready to be the hero of your own story? It's time to put the power of your health back into your hands. Join us for our free 25-day journey to get your life back now from chronic illness. Our doctors and experts will guide you back to optimal health.
All right, Dr. Nelson Bulmash, I'm back. You're listening to Health Matters. We're on twice a month, every other Tuesday, 5 p.m. Eastern Standard Time. I always have amazing guests. My guest today is the wonderful Dr. Ellie Campbell. We're talking about the 7 deadly myths of managing heart disease. Ellie, I got to hear another case study here. That was fantastic. I'm learning as well here. This is really great.
Let's talk about a little bit. This leads into the subject matter of genetic testing, which we haven't spoken about, in diet.
Okay.
So right now, keto is all the rage.
Yes, it is.
In a ketogenic diet, the idea is you give up almost all carbohydrates, eat a very, very high-fat diet, and the theory is we're going to shift your metabolism from burning carbohydrate to burning fat as a method of weight loss and as a method of lighting up your brain, because your brain really likes to live off ketones.
Ketones, right.
And so most people who go on a ketogenic diet say they think more clearly, they're more energetic, they sleep deeper, their life is happier in general. So that would be a good thing. We would all want that. Except that when I've asked patients to come and see me and have their blood tested while they're on a ketogenic diet, and I've been shocked that most of the patients, 4 out of 5 that go on ketogenic diet, have very unfavorable cardiovascular numbers during ketosis.
Wow.
Their triglycerides triple. That's not unusual. Their LDL cholesterol can go from 130 to 200 or more, and their inflammation marker, high sensitivity C-reactive protein, will double or triple as well. So not only are their fats in their bloodstream becoming more sticky and more corrupted, but they're getting more inflammation in their body, which is a great way to drive atherosclerosis.
Yes, I get it.
So, so that led me to wonder why these patients were not tolerating ketogenic diet. And so one of the things that we can do is there's a genetic test called ApoE. Apolipoprotein E is a carrier molecule that carries cholesterol throughout the body.
Sure.
And when you have a genetic mutation of this, there's 3 common forms, 2, 3, and 4. If you're a subtype 4 mutation, you do not manage fat well at all. You become very atherogenic, very sticky fat, and those people are recommended to be on a 10% fat diet. That's very, very low fat and very difficult. Most people cannot do that on their own. They require a dietitian to work with them hand in hand so they can learn how to eat this very low fat diet. But for their health, if they have ApoE4 type, they should never do ketogenic diet, and they should always be on a low fat diet to protect their heart. So that's a different subtype. We don't see many of those patients, but when we see them, changing their diet can be life-saving.
Literally life-saving.
Yes.
That's fascinating. You're the first person I've heard talk about that.
Yeah. So, and another diet, so that's a case that I've seen now 4 out of 5 times in people who go on ketogenic diet, is they don't tolerate it well. So if you're going to go keto, get checked.
Okay, good. Give me some recommendations of specific supplements that you use routinely to help improve somebody's heart health, if you will. So,
Right.
in other words, ways to decrease the risk of having a coronary event.
Well, the first one is vitamin D. Isn't that a surprise?
Not for me, but maybe for the audience, yes.
So vitamin D is actually a hormone.
Yes.
And we always knew that it regulated calcium. Well, guess what muscle in your body uses a lot of calcium? Your heart. Right?
Yeah.
So it regulates your blood sugar and your blood pressure as well as your calcium. So vitamin D deficiency can lead to high blood pressure and high sugar. So one simple vitamin, which is actually a hormone, can lower your risk of heart disease just 3 different ways with one supplement.
Well, and it's interesting because I still have almost everyone who comes into my office that has a deficit of vitamin D3 when they're tested.
Right.
It's hard to imagine that, in 2018 because there's such a prevalence of information about how important it is.
Right, but we don't get in the sun, so that's how we were intended to get vitamin D, and we don't soak it up from the sun anymore. You have to be no clothes from the waist up at noon in order to get enough vitamin D, and our culture doesn't permit that. So that's one. Another supplement that I commonly recommend if you have corrupted particles, if you have too many marshmallows per serving, niacin is vitamin B3, and that lets your liver puff up your cholesterol a little bit before it's dumped into your bloodstream. So vitamin B3 can reduce particle numbers and dramatically change your risk for cardiovascular disease. Don't do that without a doctor's help because it has to be tracked and monitored. It can make you flush. In fact, the no flush niacin is the no work niacin.
Yes, thank you. Thank you for pointing that out. Yes.
So we want vitamin B3 or niacin helps, and fish oil, omega-3 fatty acids in the form of fish oil. We measure people's fish oil levels. I do a blood test to measure their omega-3 to omega-6 ratio.
Right.
And we make sure that they're getting enough omega-3s. And for most people, it takes a lot, around 2,000 to 3,000 milligrams of fish oil a day. And you have to read the label on the back because a lot of those fish oil bottles will say 1,000 milligrams on the front, but you turn it around on the back and it says EPA 100, DHA 100, and the total amount of active ingredient is 200.
Yeah, not going to get you in the game.
The front of the bottle says 1,000. So.
And Ellie, I want to mention something because we know how important fish oils are. However, it's really important to get your fish oils from a reputable company.
Absolutely.
Yeah, because one of the things that I have people come in and they have got this junk fish oil, and of course, what's it's contaminated with? Heavy metals, dioxin. So, folks, make sure you get your supplements from really reputable sources. It's always best to have an authority like a Dr. Campbell or myself who's overseeing your healthcare.
Yeah, and you'll have to pay for it. It's not inexpensive. You'll probably spend about $1 a day to take a quality fish oil. So if you're buying 1,000 pills for $10 at Costco, it's
not working.
Not going to work.
Excellent, excellent. I'm sorry. So we talked about vitamin D3.
D3,
we talked about
niacin, and fish oil. Another one, dark chocolate.
There you go. Go, girl. You hear that, ladies? Dark chocolate? Go ahead. The floor is yours.
Eating about an ounce, which is about the size of a large postage stamp, of dark chocolate every day is full of polyphenols and antioxidants that help unrust your cholesterol. So I'm going to recommend that you consume a piece of dark chocolate, at least 70% cocoa, every day.
This is why my wife lectures to me about making sure that she's not having her cholesterol oxidized.
Right. Another one is cinnamon. About 1 gram of cinnamon is really good, especially for helping modulate blood sugar. So cinnamon is another great supplement that we commonly recommend.
And once again, folks, there's a lot of junk cinnamon out there, so make sure you're getting it from a reputable source.
So, and beyond that, a lot depends on your individual lab tests and symptoms and history and a willingness to participate in the program. Because if I'm going to make you swallow too many pills and you're not going to swallow any of them, we're not going to be in good partnership.
Yeah, very, very true. That's actually one of the hardest things for me right now. It probably is for you as well, because most people eat food. And when I say most people, it's easy to fall into this category because so much of the food that we have today, Ellie, isn't real food. Right. Matter of fact, I was reading not long ago that the average orange in the 1950s had 50 milligrams of vitamin C. You know what it is now today?
I don't.
About 5 milligrams.
Yeah.
So you'd have to have 10 oranges today to get at the equivalent vitamin C in an orange that was taken from a tree in the 1950s.
Yeah, and cold storage reduces the content of vitamin C. So the longer you keep it, even if it started at 5, you keep it in your refrigerator a few weeks.
Yeah.
Grandmother didn't have a refrigerator. So,
Right.
So she had to buy fresh and eat fresh, and we don't.
Yeah.
And I think that's such an important strategy is to let's talk about antioxidants in foods. Because while cinnamon has antioxidant properties and dark chocolate has antioxidant properties, where those antioxidants come from, to me, is an interesting story.
Go right
So when you think about a piece of a fruit growing on a tree, if it's on the corner of a rocky crag and there's wind and there's rain and hail, that plant has to protect itself. So it creates darkly colored, thick skin to protect itself against the elements. Well, it's antioxidants that protect that fruit from the elements of Mother Nature. Well, if the plant has antioxidants in it, when we eat that plant, we consume those same antioxidants.
That's such an amazing point. You're right. And think about this. Those fruits are in the sun all the time.
Right.
So whenever there's sun, they have exposure. So we eat what they use to protect them, and it helps protect us.
Exactly right.
It's wonderful.
So one of your best strategies to not get heart disease is to eat 9 servings of brightly colored fruits and vegetables every day. That's hard to do, but if you get 3 leafy green, 3 brightly colored, and 3 that contain sulfur, which include broccoli, cauliflower, cabbage, kale, those sorts of vegetables, you will do leaps and bounds to protect yourself against not only heart disease, but cancer, Alzheimer's, and diabetes.
Excellent. Excellent. So, you know what time it is?
No. What time
sorry.
is it?
It's time for final thoughts, which means we have only a few more minutes left,
Okay.
Allie. Share your final thoughts.
Well, my final thoughts are that heart disease is optional. You can beat the heart attack gene because 20% of your risk for heart attacks is determined by your genes, but 80% is determined by your lifestyle. No heart attack prevention program is complete without a dentist and a hygienist on the team. There's never normal to have blood in the sink when you do your oral care regimen. Right. And if there is, you need to be seeking care immediately because one toothache can lead to 1 heart attack in a very short amount of time.
Frightening. It's interesting you say that. May I just quickly?
Please.
I've had 2 patients in 24 hours who both said, Nelson, something's wrong with my heart. And both of them had abscesses that had newly formed and were creating heart stress.
Yes.
In 24 hours.
Yes. So it can happen, absolutely. And most of those teeth don't go bad overnight. There's been warning signs. Don't ignore them. Know your numbers. Go to your doctor. Ask. Read the book, Beat the Heart Attack Gene. Every one of your listeners should buy it. It's on Amazon and Audible. And once they read the book, they'll have a checklist of blood tests to ask their doctors for specific tests so they can be empowered with information to make lifestyle changes so that they never have to suffer the ravages of a heart attack.
Excellent. Allie, it has been such a pleasure. Excuse me, Allie. My voice is, I don't know what it is. I'm getting a little phlegmy here. It's been such a pleasure, Allie, to have you on the show today. Thank you so much.
Oh, you're so welcome.
You're such a wealth of information. How can people reach out to you?
Awesome. I'd love for people to come see me in my office. I've been in Cumming for almost 30 years, Cumming, Georgia, about 30 minutes north of Atlanta. I have a concierge-style membership practice called Campbell Family Medicine. I have an amazing team of a health coach and a receptionist, 2 medical assistants. We've been working together for many years now and have a fabulous team. CampbellFamilyMedicine.com is our website. Our office number is 678-474-4742. We are accepting new patients. It's a membership-only practice. We don't take any insurance, although we'll try to bill out your ultrasound tests or your laboratory work, whatever might be needed to insurance if it's covered. And we're always looking for empowered patients willing to make changes in their life, because when a patient reaches their optimal health, they can reach their optimal goals, whatever this world has set out for them.
Excellent. Thank you so much. All right, folks, you heard it. And I can tell you that Dr. Ellie Campbell has an amazing reputation in the community. She's helped a lot of the people I know and love, and she'll help you too. So reach out for her. Okay, folks, this brings us to the end of another wonderful show. I'll be back October 2nd. My guest is Ione Butler. She is an actress, she is an activist, and she is somebody who really supports uplifting content in the world. Her site is Uplifting Content. Look forward to her. She'll be another amazing guest. Dr. Nelson Bulmash signing out. You've just listened to another edition of Health Matters. I'll look forward to being with you in 2 weeks at 5 p.m. Eastern Standard Time.
Edition of Health Matters with Dr. Nelson Bulmash, where we help you discover how to ignite your mind, body, and spirit connection. Join us next time when we will bring you more exciting guests and engaging topics. Meanwhile, feed your mind, exercise your body, and nurture your spirit. The United Intentions Foundation and its associates take no responsibility for the opinions and statements made by the talk show hosts or their guests.